Hi, we're Paul, Jess and Charlie. We decided to get tested. Charlie's been sick on and off for the last 3 weeks with kind of cold, flu symptoms. Jess and I have been sick ourselves in the last couple of weeks, and 11-month-old Bub Emerson's also been a little bit sick and off as well. So we thought it was important we go and get tested. We were concerned obviously about infecting friends and family.
Yeah, it's a socially responsible thing to do, so we don't spread it onto the community.
You show me how to cut the mushrooms?
The Barker family is facing days of self-isolation. They've just been tested amid Melbourne's escalating COVID outbreak.
It wasn't a painful experience at all. We're happy we've done it. Hopefully we'll get negative test results back in the next 24 hours or so. And then we can kind of get back to some kind of normality as well.
And they've done absolutely the right thing. They've come to be seen, they've come to be tested, and they're going to go and properly isolate at home. I've known the mother since she was a little girl. So I've seen her grow up, and now I've seen her with her own children. The first swab goes to the back of your throat, and then the same swab goes up each nostril.
It's a stressful time for local GP Dr Mukesh Haikawal, who tested the Barkers.
The testing has increased dramatically. In our clinic, we are seeing more coming through with the latest announcements of the so-called hotspots.
Today, 64 new cases were recorded in Victoria, none of them from returned travellers in hotel quarantine, meaning all new cases spread within the community. In response, Premier Daniel Andrews announced suburbs in these 10 postcodes around Melbourne would go back into lockdown.
This is going to be deeply painful and damaging for those businesses involved. This is the public health advice. This is what we must do now.
The Victorian Premier says the 4-week lockdown means residents in the 10 postcodes must stay home except to shop for groceries, provide care, exercise, study or work. And it will be enforced by police who'll be handing out on-the-spot fines.
The idea of a lockdown or ring fencing or whatever you want to call it means isolating those affected suburbs, certainly in the context of the current outbreak, and restricting movement. Now, if we're confident that we've only got COVID cases in those areas and not outside it, then the outbreak can be controlled. So it's a very effective measure. It's a measure that's been used over the centuries.
Infectious disease specialist Dr SANJAYA SENANAYAKE believes there is still time for authorities to get on top of the outbreak before it becomes a second wave.
The situation in Melbourne is of major concern. Any outbreak with COVID cases in the country now is of major concern, and it is important that we make a fuss about it. However, just because there is a surge doesn't mean that it is uncontrollable. Community transmission, if left uncontrolled, will lead to that uncontrollable surge.
The decisions made here, whether they are fit to only have a drive-through.
When 7:30 spoke to residents in the hotspots before the lockdown announcement, many were already considering how it could affect them, like Sharon from Sunshine West, who manages a truck driving company with her husband.
Being in an essential industry, you would be taking 2 breadwinners away. Unfortunately, we just have to accept what's happening within the world. So we would be respectful of that. Would it affect me financially? Yes, it would. The world's gone mad.
You don't have any respiratory history?
No.
What we've seen is an uptick from 0 for 2 weeks to now 60, 70 a day. So it's very reasonable to be alarmed about that, because this bug will multiply rapidly if it's given the chance and spread worse than wildfire should it happen.
At his clinic in Altona North, Dr Haikawal remains concerned Victorians aren't taking the growing threat seriously.
So the message is, this is real, and if you don't do the right thing, it's going to get real even in Australia, where we've been so lucky.
But he's not convinced suburb-by-suburb lockdowns are the answer.
And I'm not sure if locking down a suburb or a suburb within a local government area is the right thing to do. Why? The virus doesn't know where to stop and where not to stop. It's everywhere. We are all liable, we are all vulnerable, we are all at risk, and we've all got to do the right thing. We did it very early on in the piece. We just got to keep doing it.
They don't want to come to Broadmeadows because it's very risky. They're too scared to come in. But it's very heartbreaking because I'm losing all my customers.
Mona ALKOUR's beauty salon is in the hotspot suburb of Broadmeadows.
We're saying, like, we're going to get locked down. Like, I don't know nothing about it. They should come and tell us, like, look, you're gonna get locked down, so you can get ready. How am I gonna accept it straight away? Like, oh, I have to lock down. Like, it's not easy for myself.
The mother of 3 says customers were just starting to return to her salon when coronavirus cases started rising again.
I was making 1,000 a week. I was making more than this a week, you know? Like, I was making like heaps better a week, but now it dropped.
And as her suburb goes into lockdown tomorrow night, the Victorian Premier threatens more could follow if numbers don't improve.
We've actually led the world in COVID control in many ways. Let's not lose the battle by dropping that ball.
You want to put Daddy's headphones on? I think lockdown, personally, I think it's a great idea. Whatever we can do as quick as we can to get through this.
Hi, I'm Lee Sales. Thanks for watching this story. If you'd like to watch more of 730's stories, they are on the left of your screen. And tap on the button below to subscribe and get the latest from ABC News.